transfer technique. I've never seen two people do it in the same way. There are always people do it completely. Anil does it totally different to the way I do it. But the end result is still the same. So nobody is right or wrong, whatever works for you at the end of the day. If you do the embryo transfer technique literature search, this is what will come up. I can't even fit it into the slides. It is, don't try to even read it. it is basically, there are so many suggestions, different publications. I mean, it just goes on forever. Look at that, 3 slides full of about 50 different ways of doing embryo transfer. And that tells you that there is something more to it, and nobody is entirely sure what they should do or shouldn't do. But we need to simplify, we need to break down the embryo transfers into little pieces. It's not just the technique that is important, it's also what you have given to the laboratory as egg quality. So it matters a lot on your stimulations, how you've stimulated patients, how you've collected eggs, you've not collected eggs at very high pressure of suction, because if you use, you've got 5 minutes to do an egg collection, let's say, and you use a very high pressure on your suction pumps, you will fracture the eggs, you will damage the eggs. So all of that matters, but the embryo quality is equally important. And we know that it depends on age of the patient and multiple other factors that we've been discussing about. It also depends your success eventually onto how many embryos you transfer. Of course, it's a no-brainer. More embryos you transfer, the more likely it is that you will get a pregnancy. But it is not necessary that you will get a live birth if you transfer more embryos. You're more likely to have miscarriages, early deliveries, prematurity, etc. Of course, embryo transfer procedure is very crucial, and Anil and I will both show you what we do, and subtle differences and subtle changes how we do embryo transfers. And we'll practice that on the models with you so you can see how we do. It also depends on, many years ago, whether there were fresh embryos or frozen embryos. That depended the success rates, not anymore. I don't have any preferences whether I transfer fresh or frozen. For me, they both give equal amount of chance of success, probably a little bit more with frozen now because of the reasons that we have discussed. And then, last but not the least, luteal support. That we know that in frozen embryo replacement cycles, etc., you need a good luteal support. With fresh cycles, probably luteal support is not that important. So there is a whole number of factors that leads to a successful implantation and a live birth. I'm not going to talk about embryo quality, number of embryos to be transferred. So is it that the more the merrier? So you look at the embryo transfer number limits in